First edition begins this hour discussing the FDA's plan on making the COVID vaccine process more like a flu shot.
The agency plans to assess COVID mutations every June and then prepare an annual dose for the fall every year. They say most people will only need one shot, but those with certain risk factors may need two. The proposed plan will be discussed today.
And with that, Dr. Salim Sarani joins us live to discuss further. Dr. Sarani, straight up, this is going to be just like the flu shot?
Good morning, John Thomas. Glad to be here. I think we talked about this almost more than a year ago when we said that when the Omicron came in, it was very infectious, but it was not lethal. And the virus keep on changing the variant, and different variant of Omicron were coming in. And we said that, what it means is it's just going to behave like a flu. Because when the virus wants to survive, it becomes infectious, but it doesn't want to kill you. Just like Delta virus, it was very, very high mortality. But as we pass from Delta to Omicron and the subvariant, it's just behaving like a virus who wants to live with you, just create a havoc, infect a lot of people. But if you have the herd immunity and a vaccination, it doesn't cause the mortality. So this is no surprise. FDA panel is going to vote on it today. So still, it's not done deal yet, but I have a feeling that they would and they should go for it. Because if you look at it, the variants are going to keep on coming in, and you can't keep on getting a booster shot every few months. So what one has to do, since pretty much most of the population in the world has a herd immunity, whatever the circulating variant is, just like for flu, we look into the Australia and take the circulating variant, create the flu shot. And usually, efficacy of 50% or more is good. The main role is to prevent any serious infection. And I would not be surprised in the near future, we should just have one shot called a COVID flu, which will have a COVID and a flu shot together. And that can help us to protect against most of the variants which are circulating 3 to 4 months before that.
And Dr. Sarani, really quickly, is this something you think we'll start seeing this summer and into fall, the shot available?
That would be not impossible, because if you look at a flu, they go with a changing variant. We look at December or January, February in Australia, what are the circulating variant, because it's winter there. And then we go ahead and start designing against the key main variant, which you think may be prevalent in your community. And that's the reason sometimes you feel that flu shot doesn't work that good, because it doesn't cover the variant. And sometimes it's very effective, but as long as it is give some immunity and protect against serious infection, that would be the main goal. And it would be more easier for folks to digest, because we are coming with so many different variation, and this shot and this variant is coming, where to stop. So I think we even talked about it about almost more than a year ago in this channel, that we should be seeing something like that. And I'm glad it is going in that direction.
Well, Dr. Sarani, as always, we appreciate your insight. Thank you for joining us this morning, sir. Always a pleasure. If you have a question for Dr. Sarani, send us a text at 361-855-6397.